I'm Joe, Lynn, just so you know who's who. Transforming a health organisation, learnings from lean agile transformation of the CDHB's Information Services Group. Longest presentation title ever. But it's a good story, I think. That's the reason that we're talking here. If you think back to perhaps 12, 18 months ago where you were at, maybe in that time you've changed jobs, maybe in that time you've got a new role, maybe in that time you've learned a whole lot of new stuff. And in that period of time, Lynn and I have been working in the Information Services Group at the Canterbury District Health Board, trying to impact change, trying to go through an agile transformation. And it's hard, but we thought it was a good story, that we had some successes, we've had some failures, but there's some learnings, I guess, is a more correct term. And we wanted to bring that story and talk about that story and see where we're at. And in putting this presentation together, we've done a lot of introspection, a lot of talking about what we did 12 months ago and why we did some of the things and what we might have got slightly wrong, what we might do differently. And we put together a rough blueprint, I guess, in terms of our agile transformation that if any of you are looking to do an agile transformation, you might want to take forward as a rough guide. Guidelines, we're not being very prescriptive. In agile Scrum terms, we're not trying to tell you how to do it. We're just giving some rough guidelines along what we did and talking about some of the successes and some of the learnings that we've had along the way. So it all started with, I guess, one simple idea. How do you take a group which, inside an organisation which is seen as underperforming and transform them so they are performing and prepare them for the road ahead, the new technology that's coming up, the new work that we know they have to do? And how do you take the people with you? So two simple ideas. How do you transform an underperforming organisation and take the people with you and change their mindset? Three simple ideas. Take the people with you, change their mindset, and transform an underperforming organisation. And also develop an exit strategy where we're not stuck in there. So 4 simple ideas. So immediately you start to see that transformation is hard. It's complex. It's not straightforward. There's no one single thing that we can point to and say, this is how we do it. So first, some context around ISG.
Yeah, so a little bit of context first around Canterbury District Health Board for those of you who don't know much about health or the health system. So Canterbury DHB is a large organisation. This is our Christchurch Hospital facility. This is the new a future view of our new acute services building, which is going to be built because of the earthquakes that you're well aware of in Canterbury. This is one of 4 hospitals that we have in Christchurch, and then plus all the rural hospitals as well. So the services that we provide obviously are for the population of Canterbury, but it's also, we provide specialist services to the region being the whole of the South Island, and also some specialist services to the other parts of the country. One example of that is the spinal unit. We employ 10,000 employees, so it's the largest employer in the South Island. And the area that we cover is fairly large, so it goes all the way up to Kaikoura in the north, and yes, the recent earthquakes a couple of weeks ago are in our area, so we're getting very good at responding to earthquakes and keeping health services going through those types of emergency situations. Down to the south, it goes down to Ashburton. It covers all the way across to the Alps, Southern Alps, and we have a partnership agreement where we provide a lot of the support services to the whole of the West Coast as well. So our coverage area is rather large. Back in 2009, the Canterbury Health System started work on this vision. And when I talk about the health system, that's obviously the CDHB, but plus any other organisation that's involved in providing health within Canterbury. So that's all your GPs, your community pharmacies, your nursing agencies, etc. And that health system employs another 10,000 people. So as a whole, Canterbury Health System, we've got about 20,000 staff. We started work on this vision, and the reason why we started work on the vision was because if we didn't do anything differently, if we carried on providing services the way we were providing them, we knew that we'd need to build a hospital the same size as Christchurch Hospital again by the year 2020. So it was called our 2020 vision. And this was a whole of system vision across all those agencies I've mentioned, based on connected around people. So people at the centre, and our persona is Agnes. It's trying to keep Agnes well and safe and healthy in our own home, so trying to keep people out of our hospital systems. A connected system, so that we all work together, that we used our money wisely, that the system spoke to each other. And the main aims, the main currency in our system is time. So providing services which don't waste the patient's time, but also which don't waste staff time. So that was our vision. And we'd started that in 2009. So when the quakes actually came along, we were fairly well along a path, and that helped us enormously in our quake response. So what does that mean for an information services group, which is what we're talking about today? So for information services, their part of this vision was an integrated and shared patient record. So again, we've got patient at the middle, and we've got clinicians being able to see patient information when they needed to see it, at the right time, when they're needing to make decisions about patient care. We've also got patients' involvement in this vision around them being able to see their own information, them being able to contribute to their information, access information that's going to help them keep safe and well in their own homes. So one part of that vision that we saw in action as a result of the quake is HealthOne. And again, this was a whole of system response because, and this is just to say some of the good stuff that is happening down in Canterbury, but we realised we needed to do better. But this was a response that immediately after the quake, buildings couldn't be used. We still had a lot of paper-based forms, so clinicians couldn't see the information they needed to make those decisions around patient care. So it was a rapid response around how do we make that visible. So now you've got GPs being able to see information that discharge summaries from the hospital, doctors. You've got doctors being able to see what medications patients are on, what's been happening in the GP practice, etc. And so for the layperson, that's also a little bit of a, what, didn't that exist before? But actually, no. In our health system, it's very disparate still. So even though you'd think everybody would know everything about your healthcare and it was easy to access, it's not the case at all. But this was a success story, which actually won some awards. So some things are going really well.
So as we start towards talking about this transformation, it's important to acknowledge that it wasn't completely broken, that there was some good stuff going on, but they had an idea of where they were going, and they needed to have a plan in terms of how we're going to get there.
So a little bit more about ISG itself. So this is what it does. It provides and maintains all the hardware and software, telecoms, all the infrastructure needed to support our systems, application support for all those facilities I mentioned earlier, plus for some of the regional hospitals as well, wider across the South Island. It's got about 107 full-time FTE, but when there's major projects that gets boosted to support that project work. It also has to deliver on national IT programs. So again, being a public sector system, we're not always in control of our own destiny, and we get a lot of national, regional programs that we get told we have to do. And the service group itself, consists of service desk, operations support, project teams, user support and training, etc. So that's a little bit of context around the department we're working with. So really, what was the problem? And the problem really is Joe was saying, it wasn't all broken, but the problem was that with our vision, I guess, Canterbury Health System vision, with the direction of e-health nationally, there was a huge amount of demand on ISG in terms of what the system was expecting them to respond to and deliver. And these big programs of work are either happening now or very in the very near future. So these are things around nationally having an electronic medications program, getting rid of the paper-based writing out prescriptions and drug orders, etc., to an electronic system for medications and prescribing and administration. Also regionally in the South Island, we're wanting to change our old and outdated patient administration systems onto one single platform across the South Island, and Canterbury's gone first on that. Also having a regional HCS program, so that's the clinical tool, the clinical portal, I guess, where the information around what happens in the hospital is placed. And again, these two systems, the PAS and the HCS at a regional level, will enable, no matter where you are in the South Island, if you need to go to healthcare, your patient record is visible, where you've been, who you've seen is visible across the South Island. And for us in Canterbury, with our big rebuild program post-quake and the vision to be a digital hospital, well, what does that involve in terms of information support? So this was really an increasing demand, sort of a surge of demand, high expectations, almost because of the success post-quake response. You know, this is what we can do, so let's do more of it, let's do it faster. And ISG were willing and wanting to look at ways to improve, but because of the enormity, realisation was we needed some external support, and that's why we contracted out to Assurity. Hi.
Any reason why it's only regional specific? Why not the whole country? Why aren't all of the HB suites, or where you guys contact or something?
So there's similar, like a PAS system, patient administration system in the North Island, but no, there's no one central national system. So yeah, that is a good point. But also you can take some learnings from other countries in the UK. They tried to do that. They spent billions and failed. So, you know, again, you can argue around do it smaller, getting something that works. So then so that's when we went for some external support, and this is where Assurity came on board.
So Q Assurity, Q sales opportunity. In starting to look at this, the first point in this transformation was getting a view of the current state. What's going on in the Information Services Group, or ISG, as a starting point before we do any kind of work. So you'll see this blue slide pop back. We'll be adding points to it. And this is really the major steps that we did. So first point, know your current state.
Yeah. So this was about a 3-month exercise, and a lot of gathering information, a lot from the internal staff themselves through interviews, surveys, what's working, what's not working. Some quite honest feedback came through that process. Also running some workshops with them. Similarly with external customers, again, what's working? Do you know what ISG does? How do they deliver their service to you? Again, surveys, interviews, key stakeholders. And then we ran workshops to try and get our processes mapped out, and from those came a whole lot of improvement ideas from the staff themselves. So this discovery phase, as I say, took about 3 months, and at the end of it we wanted to have a visioning workshop so that we brought all those key players into the room to actually talk about the vision for where ISG wanted to be, what type of service it wanted to be, and what type of delivery it could give to its customers.
And so that's important, I think. Some of the feedback was honest, realistic and brutal at times, it was quite fair to say. So out of that, there was a whole lot of opportunities and findings.
Yeah, and so these were some of those key findings. Won't go through all of them, but from within the staff themselves, a lot of discussion, a lot of comments around pretty immature processes. You know, if you're a new member staff or even you've been there a long time, it wasn't well known how things should work, how they did work, was it well documented or not. Communication came through as an issue, you know, some of the communication top down, but also how does staff bring ideas forward, how did they communicate upwards, but the horizontal communication too between teams, and how do we hand over work from project to BAU. So communication was a big theme. From the customers themselves, project prioritisation, really no idea as to how their piece of work got accepted or not, and where it was in a prioritisation scale, and some feedback around needing to understand the clinician's needs better, you know, because the service is there to provide information at the point of care when clinicians needing it, but there wasn't the sense that they were in the business understanding that as well as they could. So lots of opportunities for improvement.
And so, you know, once we got a view of what the current state was, we now had to put together a plan, and the term used up here is rough plan. Being agile, we're not trying to be prescriptive in exactly what that plan is going to be. We know it's going to change. We know that we don't know everything. We know there's variability in how we're going to go about this. So we decided to put together a roadmap with high-level steps in terms of the building blocks to get us to the 2020 vision.
So this is that roadmap, and as you can see, it's staircase-led. We thought that there were some really core sequential activities that needed to happen. Around the outside, we've got some sort of standalone activities, again, that still needed to happen, but didn't need to happen in any particular order. We're really mindful that there were activities outside of ISG's control. So this is where it participates as a regional player. When there's regional programs, they have to do they have to do it, but they don't have control over that decision. But they do have control over perhaps when they do it or when they phase it in. So it was understanding the external and the internal influence that they had. And we used the Lean transformation model house as a bit of a framework as well for our roadmap. So you can see with this next slide, this is just one of those roadmap steps, people process framework, and it's how does each one of those steps link to the house. So again, we've got establish the processes, build the people, but we've got tasks and activities in each roadmap step, things that generally need to be done, such as we need to set up some better delivery frameworks. We need to do some work on building the team, people really knowing their roles, responsibilities. We need to do some work on making our processes visible and transparent. So that was how the sort of roadmap was constructed, and that was the sort of detail within the roadmap that we built, linking it to the transformation model.
So then we had to work out how we're going to do delivery. And that you saw in the previous slide, the top point was development of delivery frameworks. So we put together this group called the Lean Group, which essentially is senior management at Information Services Group, senior management and a few of the team leaders running in a Scrum-like fashion. So we're running 1 month sprints. They still do daily stand-ups twice a week. They dedicate 8 hours a week to this lean work. We still do sprint review. We still do retrospectives, we still do sprint planning. So to those of us who are familiar with Scrum, this will look and feel like Scrum. So you can kind of see we've got a way of delivering on this roadmap now as we put together a way of managing the work and the way that people can get into a rhythm, I guess, and that comes back later on talking about rhythm. So when we talk about the Lean Group, we're talking about the senior management who are helping to transform this Information Services Group. And so once we've got a plan, we've now got a plan, we know how we're going to do it, we know roughly where we're going, what we're going to do, we know where we're at the moment. The next step for us was to find the key metrics. What are the things that we're going to track which are going to allow us to know whether we're being successful or not, whether we're moving the needle. And so in working with Lynn, we put together some key metrics in terms of what are the things that we want to measure as we go along this journey.
And so this was formalising with that management team. What do they want to set as their key performance indicators? What do they want to formalise as those KPIs? So they wanted a financial one in there. They wanted one in there, obviously, around service delivery. So how effective is their service desk? And they set up abandoned call rates as one of those metrics. What's their incident resolution time to the customer? Set up a metric around that. The application uptime metric was a really important one, because the more that in health we're moving away from a paper-based record to a clinical record and clinical information systems, the more important it is that they are available to clinicians when they need that information. So if the system's down for any reason, whether that's an application failure or a telecommunications failure, the clinician doesn't care why, they just know they haven't got the information when they're seeing the patient. So that's critical for their customers. So really wanted to measure around that application uptime. Also, the recur and sustain task was a measure there, because a lot of ISG's work is keeping the lights on, is business as usual, keeping all the systems working behind the scenes. So I really wanted a sense of the measure of, is that work getting done? Because the tendency was that the shiny, enhanced project work would take priority over this really key BAU stuff. So they wanted a key measure there. And then the other one that they wanted to start measuring was knowing what their staff were doing, because that was invisible to them, and it was also invisible to the business around where that 107 FTE was being spent on what sort of tasks. So there were some of the key metrics that we set up, and we also realised we needed to have a metric around our actual progress against this roadmap. So how were ISG doing through this transformation piece of work?
And I think it's important to note that some of these metrics existed already. Some of them didn't. Some of them we had to create, and this staff utilisation is a good example. But what we had now was a central point to put a focus on those metrics. How are we doing? So there's a monthly, fortnightly, weekly management meeting now where they look at these metrics. They come out monthly, but they're reviewing against these metrics all of the time. How are we doing? So staff utilisation was a good example, a good wee project which showed the thinking that we could get and the way that we could be successful. So the challenge for the Lean group, the senior managers, was we need to know what our people are doing. We need to know what they're working on. How do we do that quickly, in a cost-effective manner, and with the least disruption to people's daily work, and ideally utilising existing technology that we've got in the organisation. So this was a user story which came into the Lean group. We want, we want to manage, understand where our people are, where our people's time is utilised, so that we can make sure we're working on the most important stuff. And then this project, they decided on Toggle. I don't know whether any of you have used Toggle before. Really simple time metric measuring application, web application, sits on people's desktops and reports centrally into an admin console. And this is an example of the admin console. So from one day, not knowing what people were working on, how much time has been spent on project work, how much time has been spent on break fix or sustain, within 4 weeks we were able to get this up and running within the organisation so that we could report on where our time was being spent. And that was really revealing. From an organisation of 107 people, all of a sudden they knew that roughly the equivalent of 21 full-time people were working on their project work. And I think at times there was an expectation that number was closer to 100. So you start to tell the story, give a picture of reality. Then you can start to look at how you might move some of these needles. And so then these metrics started turning up in a monthly report. We were able to see here, we're working on 25% of our people were working on sustained work, 29% on enhanced work, 12% on leave. So you're starting to be able to have a conversation now to go, is this what we want? 29% of our people's time is spent on project work. Is that our expectation? Is that the expectation of our stakeholders? So you start to see it flow through. You start to see things turn up and different conversations start to be had in the organisation around what's going on. So rather than being reactive and shoulder tapping, we're starting to formalise how the work gets broken up and starting to get a really good picture of what's going on.
And this is, again, a really simple way that they are measuring progress against the roadmap. Make it easy, keep it simple, using an Excel spreadsheet. Got the roadmap represented this way with all the different steps. And they've set this measuring tool themselves from 1 to 5, and a 1 we've not started. 5 is their definition of finished for now. And so on a monthly basis, they review what they've achieved in the last sprint. It's different to the review session. How are they going against this roadmap? What would they score? What would they change in their score? And again, this is they own this. This is their scoring, and you can see they're scoring themselves, fairly low. So that's good. They've got some fairly good expectations of where they want to be. They're being realistic with their progress, but it's a good way of keeping them honest to their end goal and what it is they want to achieve. But again, very simple system. You don't need to make it complicated, and as long as you monitor it and keep working, keep it live every month.
And that's something that Lynn and I try and push as well. How can we implement this in the business quickly and cheaply? Cheaply being in a time-efficient manner. So this is just a spreadsheet, as Lynn says. It's not like we've installed a system for managing progress against the roadmap or any of that stuff. It's just a damn spreadsheet, really simple. And so once we understand the metrics, once we understand the needles that we're trying to move, next step, in my experience, being an agilist, is to get started. You learn more from getting started than you do in planning. So we've got a rough plan. We've got some idea of how we're going to measure against the roadmap. Now we've got to get started. So what did we do? Started with visualisation. Encouraged the different groups inside the information services group to start visualising their work. Now, I don't know about you guys, but once you start doing that, you get all kinds of stuff. And so that's where Assurity starts, or we start to become valuable in terms of pushing in the right direction. So this is a group, the SAM team. They do mobile support, procurement, licensing of applications across the information services group and the DHB. And they were visualising their work, and I started working with them going, well, what's it showing us? What's it telling? And trying to do some planning, some sprint planning type meetings where we were trying to plan out what's going to happen over the next week. And this guy at the top, Richard, his cue here, he talked to me and he said, well, I can do planning for the next week, Joe. I can give you 4 hours this week and 4 hours next week. And I said, what? What's going on? Well, yeah, I keep getting shoulder taps and phone calls and emails asking me to do stuff. Okay, Richard, here's what we're going to do. Whenever you get shoulder tapped, whenever you get a piece of work which isn't planned, I want you to write it on a red post-it note and put it in here. So let's start to see what is stopping you from doing the work that you plan to do. And you can see here, this is telling a really good story across the organisation. So Richard's boss is able to go, well, now I know why Richard isn't getting the stuff done that I want him to get done. I know he's busy. I know he's doing some good work, but we can start to visualise it. You can start to have a conversation around this. And Jeff was the same. So you start to see that this team, they're really busy, that I know are doing good work. Now I know why. So the visualisation piece was really important as a way of getting started. We weren't going in and trying to throw a framework over people. Again, we were starting with current state. What's happening? And then trying to visualise it so we can get a really good conversation around that. And then in terms of the application team, starting to look at what they're doing, starting to implement some Scrum frameworks around these guys. And you can see here, daily stand-up, and those of us who are working in the Agile space, there's some things that we look for in a daily stand-up. We can go into organisations and just have a look at their sprint backlog, their sprint board, and tell a lot about what they're doing. Here you can see there's not a huge amount of progress, which is good. There's some stuff that's already done. The stuff that's done looks like it's the high priority stuff. So there's some good signs in here. And so we're starting to see this as a team who have gone from getting shoulder tapped, losing focus, getting pushed and pulled in all kinds of ways, working on individual pieces of work rather than functioning as a team, to now being a self-organising, self-managing team, to the point where this guy, Nick, Scrum Master, he's gone on holiday for 3 weeks, and without any management involvement, these guys have reorganised themselves to know who's going to do which bits of the Scrum Master duties over the 3 weeks that Nick's away. It's a really good sign that teams are starting to take ownership of some of the frameworks.
The other key area we started was also doing some work on them understanding their basic workflows. So ISG was a very chaotic, reactive group, and you can see from the left-hand side, this is sort of the way that work would come in. There was no single point of entry, and 60% of their work would come into individual email boxes around requests, and so there was no coordination or prioritisation. Which one was the most important? Which one should we do first? So it was trying to get some more, structure, process around their workflow coming in, and then understanding collectively their workflows and defining them. So this was a really interesting exercise, getting these 3 types of workflows defined so that there was a common understanding, not a common misunderstanding. And it took several goes to get it right. So essentially, we've now broken it down to there's a break-fix workflow, there's the sustain workflow, which is keeping the lights on, plus it can be some big sustained project work, and the enhanced workflow, which tends to be the new shiny stuff, which is what all the execs want, or it's what the region want, and where a lot of the focus often goes to. But yeah, this took a while. It was a good learning for us, but that's essentially now, they've got those defined workflows, they've got processes understood around them, and they are being managed. So we've gone from this chaotic influx of work to managed workflows.
And I think it was a really good point, really revealing point early on in the transformation. Once we knew we wanted to track the different types of work, we then needed to go back and have a conversation about how we define those different types of work. So I remember having meetings where people are going, well, enhanced work is this, and someone else across the table going, well, no, it's this. Oh, no, that's sustained work. So first learning for us was we needed to define what these types of work are. So going, as Lynn said, from a shared misunderstanding to a shared understanding. And once that was done, we could start to track them as a metric, remembering, of course, that was one of our key metrics, one of the things that we wanted to measure. And so once we started, the concept then was looking for successes, what's working, and trying to amplify the things that are working, and talk about those and make sure that we can support those things. And anything else that we can roll out across the organisation, then we do that. And there's 3 things that we're going to talk about very quickly: prioritisation reference group, problem management team, and staff engagement survey. But it's important to acknowledge your successes, understand that transformation is messy, transformation is hard, so it's important to take note of the things that are working well. This is a good example. It looks messy. This is my handiwork. The project managers, they didn't quite gel with the Scrum concept. They'd gone from a world where if they had a project, they wrote a business case which says, I need 2 developers and a BA, and while I probably need them for 3 months, I'll put 6 months in the business case because then I can hang on to them. So they were ring-fencing their own resource for their projects. And what we found is there were resources that were 50% on one project, 50% on another project, 25% on another project. And so the problem became, which one do they work on? They're already overworked. They're never going to be set up for success. How do we actually find a way of making sure they're working on the most important stuff? And talking to the director of the project management office about this, and I went away and I drew this diagram and I put it in his office on his whiteboard. This is on an A3 sheet of paper, and just left it there. And had some conversations, came back a few days later, and this had kind of taken on a life of its own. So my concept was, what you need to do is deliver on value. Take a project and look at it like this and stop delivering that whole project and go, whereabouts is the value? What if we just delivered this bit? So I came up with this concept of the value freedom fighters. And that took on a life of its own as a group which was able to prioritise work. So any work coming in to ISG, inside or outside, over here, all they needed to do was to write an epic or a lean business canvas, a lightweight piece of work, rather than doing a full business case that defined the value. What's the value in this project to the organisation? So starting to change the language, change the conversation in the organisation. And then this group, the value freedom fighters, would be a senior level group who had the ability to say, yes, we want to do that work, or no, we don't see the value, or there are other things that are more valuable, rather than just taking on more projects. Easy to start projects, hard to deliver them. So we're trying to catch those problems at the start, and obviously they had the ability to say no down here, and then work gets done in teams. And this kind of took on a life of its own, whereby they started talking about what happens in here, a gate, first gate, this is the process now for projects. If you want to raise something, rather than emailing somebody or ringing somebody, you need to go through and fill out a service request. There's that SharePoint type form. This is what we now need to do. And then these group of senior managers will meet once a month, and then we'll start to break the work down at this end, and eventually it will end up in teams down here. And we've already seen the teams are running Scrum. Look, the application teams are running Scrum down here, so they've got a delivery framework. We're now going back up the chain to control where that work comes from, how that work gets into teams. And that ended up in the information services group incoming work process. So the prioritisation reference group is what the team is now called. They weren't brave enough to take on the value freedom fighters as a concept. So that's still up for grabs. If anybody has an organisation you want to use value and freedom fighters, please let me know. I'm really happy to, if you were to take up that term.
So this is sort of that process that matured a little bit further, and as Joe said, so the prioritisation reference group is a really senior level group now, representation from across the regions. We've got that regional voice, exec level from CDHB, the senior clinicians making those decisions on what pieces of work get priority. So whereas before ISG were making those decisions, which was not appropriate for the business, but they weren't given guidance any other way. All the prioritisation decisions come through this group now. And so they have some very simple, not so much simple, they have some straightforward decisions to make. Is this new request that's coming in more important than anything else that we've got in our bucket? So trying to get down to some minimal work in progress. We're trying to get down to 10 pieces of work in progress, 10 pieces of work next in line, waiting to be moved into in progress, and then have a backlog. So decisions are, is a new piece of work any more important than anything else we've already got? And if so, what do we move out so it can come in? Or having that early decision up front that this piece of work really doesn't meet the threshold of priority, probably will never get done. We have to push it back. And at least then that gives the requester some certainty around what to do. Could they go elsewhere to look for, could they outsource if a department has some money and want to get a little piece of work done by someone else? So we're getting some maturity in our process, and actually it's been a really good selling point for ISG, because they are being seen to improve their processes and that they are looking to strive for improvement.
And so from my point of view, there's some important agile concepts coming through here. Minimising work in progress, having 10 projects on the go at once, going from an organisation which had 58 projects, and we've already worked out there's 21 full-time equivalent people working on those projects, to having 10 projects. I think currently they're at 15. 10's a stretch goal that we're trying to work towards. So the Kanban concept of minimising work in progress starts to become really important here. And then maximising flow as we move through this. And the other thing I'm getting from this conference is a lot of talk about customers and end users. And here we're pushing the responsibility for the decision up to the right level. Senior execs, which projects do you want to take on board, and which do you want to pause? We're not allowed to say on hold, are we? Pause. Which projects do you want to pause? And it's forcing them to make the right decisions. And so we're seeing a reduction in pet projects coming through, and where people are forced to have that right conversation and justify the value of a particular project. So at the starting point, there's some really good stuff going on inside the Information Services Group.
So this is another, I guess, what we call a success story, and it's not a success story around the network account lockouts per se, but it's what spun off from it. And what spun off from it was a cross-functional problem management team. So the service desk was seeing this increase in phone calls around staff members being locked out of their accounts, and so they put some solutions in place around a self-service portal, making it much easier for the clinicians to do it themselves, getting reminders, putting it in front of people, your account, your password's due to expire, etc. So I had some really good successes, but the way they went about it with this cross-functional team generated this idea, well, we need a permanent cross-functional problem management team, and so they've created one. And so they are analysing the data coming in into their service desk, what are some of those common causes, and then they are approaching those root cause analysis and solving those problems through this cross-functional team. So that's working really well for them.
So another agile concept, cross-functional teams coming through. So it's the things I'm looking for, is the mindset starting to take hold inside Information Services Group and trying to promote these successes.
So there's also been a lot of less tangible successes, and one of those is around staff and staff culture. So as you remember early, the discovery phase actually had some quite robust feedback from staff. And so they wanted to put a focus on their staff through our roadmap. And one of the things they did was another staff engagement survey, trying to look a little bit more detail at what could they do better. So whilst they were doing pretty well on a number of elements, where they weren't doing so well were performance conversations or performance management and reviews, development conversations, how do people progress their career path through ISG, and also looking at internal communications. So training was put in place, reviews are happening. This table at the bottom here is the team leaders putting their names, putting their plan on paper, so it's visible. When are we planning to do these reviews, dates, and they are holding each other accountable to delivering on this, and it's visible for all staff. Guidelines, etc., have been written around career path, and they're planning to go back and interview staff around how that's helped them. Internal communication was a strong theme, as I mentioned before, and so the way they've gone about this through user story was to set up their own internal communications group, which doesn't have any of the managers or team leaders on it. So it's a group that's created by the staff, for the staff. Their brief is to be that conduit for internal communication to improve it. And so some of the first things that they've done is, well, let's start putting names to faces. Let's make sure everybody's got a picture so that we can see, I know who Joe is when I see him in the corridor. He's a new member of staff. 107 people, quite a lot of staff. We're on a couple of floors. Something as simple as that just helps generate that staff engagement and shifting the culture. But also, they're also finding some really prime communication real estate. So at the back of toilet doors, where everyone's going to see it, in the corridors, outside the lift, watch this space. This is what's coming. Look out for what we're going to be telling you. So that's, again, a really good story.
And from my point of view, it's really good that the teams, the staff are owning this. It's not driven by senior management, senior leadership. They are deciding the best place, and they're being creative. The back of toilet doors is a perfect place to communicate with your internal people, but also coming up with ideas. Really good cross-functional team.
Okay, very briefly, some other successes. So putting duty manager in place, someone who's really visible for managing some of those out-of-hours processes, outage processes. And again, on the other less tangible side, the senior management working better as a team. So again, starting to have those more honest, open, robust, safe conversations in their meetings, challenging each other in a respectful way, asking the right questions, trying to shift that mindset. Of course, we're not there yet. It's a journey of change, and we are on this transformation journey, but we're starting to see that.
And so once we've looked at understand what's working, we also want to know what isn't working and look to change some of that stuff. So starting to see now a picture forming, a blueprint forming of how we've gone about this transformation, and also it's starting to suggest where we go. This things that aren't working is forming our backlog going forward in terms of the things that we still need to fix. And trying to set a path where transformation never really changes. You're always adapting, always developing. So what are some of the lessons that we've learned? There's a bunch of things along the way, and this is where it starts to get interesting, I guess, where we start to put our hand on our heart and go, well, these are the things that we would have done differently. Keep your lean group lean. Scrum Guide says 7 plus or minus 2. We've got 14 in the lean group. Lynn and I now know why the Scrum Guide says 7 plus or minus 2. Really hard at times to make decisions, get decisions made. Retrospectives, there's a lot of conversation. Sprint planning, there's a lot of planning to do. So it's one of the things we're looking to do is how do we trim this group? Given you've got a bunch of people who are engaged in the process, how do you keep them engaged while trying to reduce the sheer amount of admin that we're needing to do? Engaging team leaders and the staff becomes really important. Staff especially, a lot of the best work has been done by the staff. The people who actually do the work, they're engaged. Some of those stories where we've pulled them in, the stories have been completed. They got done, whereas at times the management has been a little bit overworked, I guess would be the polite way of putting it, where they've had other priorities and haven't managed to get stuff completed, but the staff, every time, on time, they'll finish it. And outside boundaries, outside business support is critical. This is my time to wax lyrical about Lynn. Lynn is not part of Information Services Group. You're from People and Capability.
Yeah.
I always forget. But it's been really good, from my perspective, to have someone from completely outside, myself, come in and observe and challenge and push and pull, but also someone inside the DHB who's outside of the Information Services Group. And Lynn's role has been really critical in terms of keeping ISG aligned to the organisational strategy, the wider strategy. So Information Services Group has its strategy, but also important that it plays with the wider District Health Board strategy, and also to identify blind spots. It's been really, really revealing for us to look at the senior management group and look at how they're assessing themselves in terms of their leadership and their senior management, and identifying that it's a weakness for them, that people sometimes can't assess themselves very well. I guess the thing I keep saying to you, which I always kind of, every time I say it, and I'm about to say it, I always go, I shouldn't really say that. It's like stupid people don't know they're stupid. That's kind of the feeling at senior management group, in the nicest possible way. They're not self-aware. They're not able to assess themselves that way. There, I said it. Train your people to fill the roles. When you're talking about senior managers in an agile context, they're time poor. So there was a perception, I guess, that these people would kind of understand product ownership and understand being a Scrum Master, but that hasn't been the case. They still need to be trained and developed in these roles. Even though they're experienced, they're smart people, they still need to be able to understand what the difference is, what the subtleties are in product ownership, and what the Scrum Master role means. It's not just an admin type role. So there's a lesson. If we were to go back and do it again, we'd pay more attention, I think, in those roles.
The continuity of people is, I guess, from the CDHB's perspective. So we did that, the discovery phase with Assurity, but then when we moved into the roadmap phase, the personnel from Assurity changed, and so that, I think we lost a couple of months on that in terms of the knowledge gained did not transfer over into the implementation phase. So the continuity of people who are delivering, I think, is crucial in planning to make sure you're getting the results as soon as you can. So that was a learning for us.
And you've got to find your rhythm. It's one of the things as an Agile consultant we look for. When does a team get it? When do they feel like they're in motion in terms of the process? And with a 1 month sprint with senior management, it took longer. It took about 6 months to feel like they were finding their rhythm, to feel like they understood that this is now the process. We go to sprint planning, we go to stand up, we've got to report, we've got to talk about what we're doing, we've got to have a different conversation than perhaps we've had previously, heading towards a sprint review where we're held accountable to the work that's delivered. So as an Agile consultant, you kind of feel like you're wanting teams to get into the habit of knowing this is how it works. Learn and improve as you go. You know, the fourth roadmap step, I believe, was get started. And it's a really big part of this whole process. We'll learn as we go. And so some of the things that we're starting to see in in retrospectives is we need to do better refinement. They also tried going from 4-week sprints to 5-week sprints. We didn't get a chance to vote in that one because we wouldn't have agreed to that, but that's what they wanted to try. They tried it, they've gone back to 4-week sprints. And so there's a whole lot of things you've got to empower the team to try. And this is the senior managers' Lean group challenging them to actually try something different rather than just saying this isn't working, this isn't working.
Yeah. One of the other things we know we need to get better at is building implementation into the story as well. So a lot of our stories, we're not a development shop, and a lot of those stories around transformation are around changes to process, and so a lot of work gets done on that change, and I think not enough has been done on implementing it in that story, testing it works, and learning, getting that quick feedback loop. So that's a learning around just keep refining this process around inspect and adapt, and add it into your story in sprint time.
And it's something that's coming out in this conference as well. You saw it with Jeff yesterday morning talking about outcomes rather than outputs. You saw it in Joshua this morning talking about delivery. It's, you're not done until you get it in the hands of your customers. So we talk a lot about operationalising the work that this team is doing. And me, with a slightly sarcastic tongue perhaps, I'm saying to this team, you guys are really good at writing a process. Really happy for you. But so what? The process doesn't mean anything to you changing something in the business, and that's what Lynn and I are focusing on.
Another key, I guess, learning is review. When would you start reviewing that this is going to plan, that you're achieving the outcome that you want? And we are at that point now of really looking at the roadmap in detail, really going back and re-engaging that senior management team with the vision, with where is it that ISG is heading, and then putting the roadmap into their own words. So prior to that, it wasn't really in their own words, and so there's a little lack of full commitment and buy-in, and so now we're at that point of putting it into their own words to make it more sustainable as an outcome. And in retrospect, we should have done that much sooner than we are now. So again, we would review perhaps after 6 months, not where we are now.
And then, final slide on terms of the lessons learned. Transformation is hard. Changing people is hard. You've got to persist. You've got to give people the chance to own that transformation, and that's where Lynn and I are at the point of trying to look for an exit strategy. How do we transform this organisation with a view that we don't hang around, that we hand it over? And leadership is crucial inside the organisation. So I think that the focus for our next piece of work is to develop those leadership skills within inside the senior management, the stuff that they're not as good at analysing themselves on. So the future, very quickly, where are we going? Inspecting and adapting as we go. It's an agile environment, it's an agile thing. We're trying stuff, we're seeing what works. As Lynn said, we're currently reviewing the roadmap, looking at where we're going to go now, trying to get the Lean group to get more ownership in that roadmap. Focusing on senior management with the view that the impacts trickle down. We've kind of stopped focusing on the teams. So the teams that are working well are working really well, but they're hitting a ceiling. And so we're now trying to deal with that ceiling in terms of how the Lean group works. And as I've said, Lynn and I are looking for an exit strategy. We don't want to be here in 12 months' time doing the same talk about how it's going. Actively looking to, probably within 6 months, look at how we get out of here. So ISG continues to transform themselves rather than need some external support. And so that's our blueprint in a nutshell. This is what we did. This is what we've done so far, and that this kind of drives a lot of where we're going from here. Know your current state, so know what you've got at the moment, develop a plan, put together a light plan in terms of where you're going, understand your metrics, what's going to move the needles, How are you going to measure success? Get started. Can't stress that enough. You've got to get started because it's in doing the work, in changing stuff, you learn more about your organisation. Understand what's working and change what isn't working, and keep going. Transformation never ends. It is hard, but it never ends, and your people are really important.
Thank you.
Thanks very much.